Thinking Aloud. Conversations on the leading edge of knowledge and discovery with psychologist Jeffrey Mishlove.
Hello and welcome. I'm Jeffrey Mishlove. Our topic today is holistic headache healing. With me is Jan Mundo, who is a certified master somatics coach as well as a certified massage therapist, and she is the author of the Headache Healer's Handbook. This is an internet interview, and now I'll switch over to the internet video. Welcome, Jan. It's a pleasure to be with you.
Thank you, Jeffrey. I'm really happy to be here.
You've been working with headaches for decades, and you've really focused in and specialized on headaches. But one of the intriguing things that you report in your book is that you seem to have developed a healing touch that when people suffer from headaches, you can lay hands on them and their headaches will go away.
Yes, that's actually how I started, and working on myself and other people when I heard that you could do that. And read a claim that you could stop somebody's headache or migraine. And at that time, I didn't even know the difference between headaches or migraines. But my mom had them when I was a kid. So I just started experimenting with it and found that I could stop a headache or migraine on the spot. And I didn't really, at that time, which was in 1970, know actually what I was doing on the head, what I was working with on the head, and anything else that was in play, including the difference between tension headaches and migraines.
Well, you've become an expert, and at this point, you've got any number of credentials dealing with headaches, and you've taught workshops and worked with headache institutes. But it seems to me there's kind of a difference between applying very specific massage types of techniques to healing people and as opposed to sort of having the gift of a healing touch.
Well, that could be that I have sensitive touch. It's possible. But I think that anybody really can hone their touch, that those are our gifts, our natural gifts. And it also is coupled with being able to focus your attention. And so it's just that it's a little bit schooled out of us, or it's not reinforced, or we're really not taught about it. It's not handed down. And so we've lost what is somewhat of an art that also can be almost a science.
When it comes to laying on of hands for headaches, that if you're using a kind of logical approach, which I think you advocate in your book, you want to know what kind of a headache you're treating, and you have different methods for different types of headaches. But if you're a psychic or spiritual healer, it seems that all of those details are less important because you're focused only on the end result, which is healing.
I have a protocol. So I have found, which I said I didn't really know what I had been doing, and that was for about 21 years. I'd just been curious and working with the headache. And then when I broke it down by steps, because I decided to do it professionally and teach other people how to do on themselves and others what I had been experiencing, I realized that I was matching up my touch with what I experience as the sensations of a headache or migraine. And a tension headache feels different than a migraine, to go back to your question. And then because a tension headache feels, and they're described this way as well in the medical literature and the diagnostic criteria, but to speak about it in layperson's terms, it's like a vice is gripping your head, and or a tight hat band, and there can be involvement of neck and shoulders and jaw and forehead. This is kind of a tightening, gripping sensation. And that's usually not associated with as much disability, although they can be painful. There are a lot more people with tension-type headaches than who have migraines, but the migraine population in the United States alone is estimated to be around 37 to 40 million people annually, and about 21 million of those are women. So migraine has more of a pulsing, pounding effect, and it's associated with a greater disability. So you can be light, sound, and smell sensitive. You can be sensitive to touch. You can be nauseated. People vomit. They get very lethargic. There can be it involves much more than just the pain in your head. It's a whole syndrome, and there are associated symptoms. For some people, it varies a lot. That's one of the reasons why I think it's so fascinating. So those are pulsing, pounding. So when you work on a migraine, you want to still that pulsing or pounding, because to put another motion in there, like a rubbing type of massage, almost makes it like you're putting another beat to that pulsating and making it worse. So you want to still and calm everything. Whereas in tension type headache, you want to loosen what's tight, and that will release it. And then often you do this it's basically a balancing, stilling therapy protocol called the Mundo method after that. And so a lot of people have combination of both, where they have the tightness in the neck and shoulders. So you want to loosen that, which actually helps the migraine come to the fore. And then when you work on the head, you work specifically with the sensations of the migraine. And what I realized again, when I broke all the steps down in the early 90s and translated them and tested them on people that I never had touched, is that there's actually a cycle of sensations to the pain. So you still it, and then it recycles to the back. I know it sounds wild. And then it releases, and you have to release all the pulsing points, whether that's one or many. And then the headache finally releases, and the sensations of the release are different than the sensations of the migraine itself. So there's a whole thing to it that's very fascinating, and it's almost like you're fixing mini explosions on the head. And so it's part holds, part touch, part energy work, part using your mind and your awareness, and what I call a mental push, or your volition. So it's really fascinating, and it's not random. What's more random is the exact spots that you work on. So you work and to match your touch with the pain. It's not in a fixed spot. So that's more, you hone your skills, your awareness skills and your touch skills. And the last thing I'll say about this is that when you work on yourself, the advantage that you have is that you already are having the pain. So you can find where that pain is by matching up your pain to your touch, to your awareness of it. And so then you work with it in that way. The disadvantage of working on yourself is that you're working on yourself when you're in pain. So you have to kind of really re-up and keep re-upping to keep that focus going and not be overcome by the pain. So it's a skill that you build over time. And that's the long answer that I believe anybody can become empowered to either work on themselves or work on someone else if they apply themselves.
Would you say that ideally it would be better to have a partner you could work with who understands how to treat your headache if you're like having a migraine or something, rather than to try to work on yourself?
Well, I think it's wherever the situation and however it presents itself, but having somebody to work on you, either a partner or a practitioner, is great because then you don't have to work on yourself in pain. If it's a practitioner or someone that's not right there with you, then you have to get there, or unless they're going to do a house call or come to you. So the advantage of, say, having a training partner, someone a coworker even, that is willing to, work on you, is that they can be right there. I had a boss that I used to work on daily, and it was very convenient. She'd call me into her office. Help. Then I'd stop her migraine. I did that when I was working in the corporate world.
Well, migraines are sometimes extremely intense and disabling for people. So to be able to stop a migraine seems like a rather dramatic form of healing.
Yeah. Well, we're not really taught how to do it. And so, but, my experience is that our touch and our mind can be mobilized to change our bodily systems. That's what I've experienced from people. And that's, I've taught at medical centers and, as you were saying, different places where, doctors have and neurologists have referred patients. We had a pilot study published. My experience is that touch and the mind can mobilize the systems in the body and in your brain and in your bio and neurochemistry and shift things just as a medication would.
If you're working on another person, are you able to sort of experience their inner sensations directly, or are you really relying on them to tell you?
Depends. I do both. Sometimes if I'm in a hurry, like we have a limited time for the session, or we've done other things like education in the session, or we want to do both, and I want to fit both in, then I might ask, where are you feeling it? And they'll point. Sometimes my hands just go there, and that's often the case.
Your hands know what to do.
Yeah, or they just go to the spot of the pain. They're like, how did you know? Like, even without the person telling me, whether it's client, friend, family, relative, whoever.
I suppose what you're talking about is intuitive knowledge that comes from years of practice.
Right. That is true. I mean, practice, like with anything, it gives you more of an intimate knowledge of the territory, right?
Well, one of your first guidelines for people who are suffering from headaches, and I'll admit I'm at a bit of I'm going to call it a disadvantage at the moment because I almost never get headaches. So this is a topic I'm not intimately familiar with, but I'm sure many, many of our viewers are. They know what a headache is like from the inside. And I have very, very little experience of that sort. I'm calling it a disadvantage, but I'm really thankful that I don't get headaches. But one of the points you make is that if you're a headache sufferer, what you want to do is understand in as much detail as possible what triggers the headache, what the pains feel like, what kind of discomfort you have, and what your body might be telling you. There might be actually buried memories that are trying to come out. Yeah.
I think that all of that is true. So I work with what's called a somatic approach. So somatic, S-O-M-A-T-I-C, has to do with how we live in our body and how we're shaped by our history. So oftentimes this gets shaped when we're very, very young, even by how we're held and touched and spoken to and spoken about, or how our family, our parents, whoever is raising us, reacts to stress in their body. We just pick it up, and it's transmitted to us in so many different ways. And so in some cases, it's done innocently, just in the course of socialization. So, sit up straight, use your inside voice, be good, be nice, stop crying. You're too much, you're too tall, you're too short. Sometimes it's just like, oh, he's so tall. But even though it might be done innocently, sometimes it could be done in a way that shapes us. Like we get all those messages. And so maybe we want to be shorter. Maybe we don't want to be taller. Maybe we want to be taller and we stretch up. Or maybe we have to stop crying and tighten our jaws. And so all these things can feed into how we live in our bodies and how we respond to the moment. So a lot of times we're responding really to our shaping, to our past, and reacting to ways that we've learned, instead of responding to what the person or the situation that is in front of us. And so that can cause us to have unconscious holding throughout our day that we don't even realize we're doing, or ways that we are able to pay attention to our body when we need some water, when we need food, when we need to stop, when our shoulders are getting tight, when we're, bent neck texting, whatever it is, just overusing ourselves without paying attention. So I teach people really it's about how to make a loop between what you're doing and what your body's doing. But there are all different ways also that we can be shaped also by trauma. If you didn't get a certain kind of attention, you needed love, you could maybe reach out for it, maybe you had to be the peacemaker in your family, maybe you had to stay safe or protect yourself. So there are all ways that we get shaped, and then we just carry those with us. So those unconscious patterns can feed into how we're able to take care of ourselves. So a lot of times it's making shifts here and there in all areas of our lives and paying attention to what we're doing.
You're really getting right down to it. Actually, it's like there's a certain knowledge that the body contains, and even though it's unconscious, a habit or a pattern that maybe is developed over years that we're not even aware of, you're suggesting that we can become aware of it and we can change it.
Right. That you can change your lifestyle, your daily activities, how you live in your body, what you do, what you eat and drink. All these little things can add up to headaches or migraines. So by making small shifts here and there, and looking at the whole picture, I call it the Chinese menu theory, some stress, some of what you eat and drink, how you live in your body, how you respond to things, your exercise, all these things can add up. And so by eliminating what's called your triggers and identifying them and eliminating them, little here and little there, you can get a different result. So some of the things that stick in your head, I had a fifth grade teacher, Mrs. Mackle, who used to say, first it's an it, then it's a bit, then it's a habit. And she used to write that on the blackboard. And we lived by that in her class. But that's true with a lot of things, including headaches or migraines. So, we're just used to living in a certain way, and it might have served us in the past, but maybe it doesn't anymore. So we usually instituted it for a pretty good reason. And so now if it's not working for us and adding up to our pain, if you break it down and then just do a little bit here, a little bit there, and it's a matter of learning what those patterns and triggers are for you, and for each person it's a little different mix, then you can get a different result. So it can be very practical, even though it sounds like, it's a mind-body program. Maybe it's not practical, but you can really learn how to be your own headache detective. And by making the shifts, you do get a different result.
One of the interesting findings that you report is something, I think you call it co-morbidity, that oftentimes when people have repeated headaches, it's related to not only just the headache itself and the antecedents of the headache, but also it may be related to some other condition, a medical condition that they're having to deal with in addition to the headache.
Right. And especially as women, there are perimenopausal things around their periods. There are different things that can happen with that are part of the migraine or coexisting with the migraine. And then there are also people might be dealing with depression, might be dealing with blood pressure problems, things around their heart. And then sometimes they might be taking medications for them. So it's things with their digestive systems. So sometimes it's hard to tease out which is from the medications and which is from the condition itself. But headache can be a secondary problem due to other causes, or comorbidity, where it just people have several conditions altogether that they're dealing with.
So you encourage people who you work with to keep a journal, to keep a record, so they begin to notice what are the different factors that it seem to be impinging on or triggering headaches.
Right, absolutely. So we look at all factors and everything, all different parts of your life, because you're not just your food or what and when you eat and drink, which are really important, especially with migraine, but you're also your environment. So how's the weather? Weather affects a lot of people, especially low barometric pressure. and what chemicals are in your environment. So some people, even artists, might be working with paints, either oil-based or acrylic-based paints. Some people might be around a lot of scents. So if you are in a department store or in a store where you're looking maybe for one thing, but you come across the perfumes section. So, some people are sensitive to scents. Some people are sensitive to the seasons. So this whole environmental category. And then how you use your body. So your posture. And it puts, like if you have head forward posture, which so many of us do, it puts a lot of stress and pressure on your shoulders and the back of your neck, the sides of your neck, the back of your head. We're under stress. So that category, also illness, so diet, and then what and when you eat and drink, and then your emotional states, the medications you're on. So we look at all ways and all factors of your life in detail as you go through your day, and you chart that in an abbreviated form so that you can start to tease out. And also when we add new practices like meditation and breathing and postural practices and sleep habits and exercise, we add those in little by little. And as people start to feel better, we see the effects of what is shifting, what maybe they're not doing anymore, and what they are doing as their day goes. And also, for some people, like you might be going along just fine, and then you go out to eat, and then there's a hidden ingredient, like say MSG or something in your food, or you have a little alcohol, and the next day you have a blazing migraine. So we try and teach, well, okay, what's the cause and effect, and what did you do different? And they're like, well, I had wine last week, or I had peanut butter last week, and it didn't bother me, but I see it did this week. So then we look at everything. Okay, well, were you in under more stress? What about that stressful conversation that you had during dinner or before dinner, or that thing that happened at work? So it's all might add up into that mix. Or maybe they had a glass of wine with dinner, but they didn't eat all throughout the day or have good quality protein throughout the day. So it's really looking at, well, what did you do and what are the patterns? And when you shift and make different changes, what's the result? And so then people see little by little, they're getting fewer migraines and less intense as they change things and as they implement new practices.
I gather you got into the study of headaches because you yourself suffered from migraines.
Yes, and so did my mom when I was growing up. So I first used to put my hands on her shoulders and neck. I remember a particular time when we were on vacation, and she's like, oh, she was miserable. And we were in a beautiful place, and she couldn't go out. She couldn't do anything. And I was working on her shoulders. I must have been 10 or 11, working on knots, what she called the knots and spurs in her shoulders and her neck, and it helped her. I don't know if she was in the midst of a migraine, and my sense is she was probably more coming into one, and it helped back it down. So that was when I was young. And I think that I had them because I would work on myself after I learned about how to do this therapy and started putting it together and playing with it. So I would work on myself, but I didn't get them really outright until I went through perimenopause, which was just between when you start going into menopause. And so your hormones are all haywire, and so I was miserable every month. And then when I started looking at it, in addition to, because I'd worked on my migraines, but that was just to stop each one. It's, a relief technique. So it didn't help me prevent them. But when I started looking at, well, let's see, I didn't get horrible migraine this past month right before my period, I would see, I've been meditating a little bit. I was eating better. I got a little more exercise. I was under less stress. So when I started putting it all together, that's what helped me. And doing a lot of reading as well. It really helped me see how to put everything together, and that lifestyle changes could make a difference even going through perimenopause. But it's pretty common for perimenopausal women to go through this. And that's actually what clued me into that I was going into perimenopause, because I didn't know. I just started having night sweats and these headaches and migraines and hot flashes. And then I kind of put it all together, because back when that was happening for me, it was happening early, and I didn't realize in my early 40s that I could be having all these symptoms. And it was kind of at the beginning. Our generation is, my generation, the baby boom generation, has tried to implement things in society and in culture and in health and wellness. And this was kind of at the beginning of that, where you didn't read a lot about menopause and perimenopause until women of my age going through it started writing books about it, and we started learning more about the body in that way.
So I gather from what you're saying that if a person pays attention to lifestyle issues, diet and exercise, things like perhaps meditation or simple breathing exercises, that that alone can, for a headache sufferer who's having frequent headaches, that you can at least reduce the number of headaches through that approach.
Yes, and that it's usually a combination of factors. And so I teach how to do each of those things step by step. So it's really the devil's in the details. It's learning how to pay attention to it. And there are ways that you can follow your pain in meditation and ease it and work with it in that way, just with your mind. There are things that you can do with your diet. So it all adds up to, like I was saying, your particular combination of triggers. And that's what we track. And people can learn to track it. Now, I do want to say that I believe it's about 50% of is attributed to migraine being genetic. So then how could it be that people I work with are able to shift and make changes in their lives and get better and feel better? You know, they get fewer migraines, they're less intense, and maybe they stop having them altogether. So there is the field of epigenetics, which admittedly I don't know a lot about any of this stuff, but I do know that it ascribes part of our health and how we live to our environment. And so even though certain people say might be predisposed to migraine, maybe some people get intestinal things more, or some people tend to get chest colds more. You know, we sometimes know the reasons for these, and sometimes they can be genetic, but also our lifestyle can contribute to us not having those genes turn on or having those genes turn off that might be predisposing us to certain conditions.
And you pointed out earlier that through the laying on of hands technique that you've developed, that sometimes headaches, even migraines, will just stop suddenly. That suggests an approach that would go beyond, conventional medical treatment.
Well, yes. I mean, I think that you can learn to use your hands like biofeedback sensors. So, we can refine our touch, and we can refine how we're able to focus our attention. And you could say, make up that it's paranormal or healing. I don't know, but my sense is that it creates more of an excitability, energy in the hands, and that with this attention and subtle touch, you can make shifts. So I look at it more as a skill, although it's maybe outside of conventional medicine, but maybe, practitioners way back when they had more time to spend with patients and they had that touch, and sometimes that touch has to do with not just a physical touch, but your presence, your ability to be calm in your body, your voice, your listening to the patient or client or whoever it is that is out there for you that you're trying to help. So it's combinations of factors that some of them are an art and some of them are a skill. And I dare say some of them are science. It's just that hasn't necessarily been studied or discovered yet.
Well, as I mentioned earlier, I'm not a headache sufferer, but it's not as if I don't get aches and pains. I scraped my knee a few days ago. It was very painful. I occasionally get back aches, and I'm guessing that many of the same methods that you're teaching for headaches would apply to other kinds of aches and pains.
Well, I think that's possible. I definitely do other body work on people. It's a little different than this cycle of sensations where you're working with mini explosions on the head and getting everything as far as the energy in the head, because after all, our brains, this is like electrical circuitry. So but through our bodies too. So it is a little different in that, but I think people can put and practitioners can put touch to pain and shift it. And some of that's opening up tightness, where we're held so tight for so long that we can't feel ourselves, or we're just tight, and that affects other areas of our body or our mobility. So, or maybe we're just like in our heads and we can't see where we're going. And, there are a lot of things that can contribute to it, but I do think that we can go a lot farther with touch and touch can take us a lot farther than it is credited. And also the other thing is when touch is studied, say, people study drug therapies and then will, try and take account of all the variables and all the situations that could happen in drug interaction and how it works in the body. And there's so many different layers of that. I don't think that's really been done as much with touch. And when I worked at one medical center, they were doing a study on massage. It was a funded study, I believe, through the NIH. And it involved a protocol where, in order to test it, you had to do a certain stroke on the arm from the elbow to the wrist. That was it. And that was how they did research on massage. So, maybe things have progressed and maybe not. But there's so many variables in a person that it's hard to get that kind of information, because one person might be tight here, even if you're working from here to here, well, up here might be tight. Or you might be thinking things are under stress that makes you tighter. There's so many factors. Somebody's touch, it's impossible to do something so uniform on a person. That's why we're not machines. And so the idea is that we can learn the body, and we can learn how to relieve our aches and pains by learning skills and the art of it and honing our attention.
One of the main areas of focus for you is breathing and breathing exercises.
Breathing is really helpful for people who have both tension-type headaches and migraines, because it helps you situate yourself differently in your body. So when you're breathing high in your body, meaning chest up, if your stomach is tight or you're holding it in, say, not wanting to have your belly stick out, for whatever reason, or, look good in your clothing, or just by force of habit or even stressful breathing forces our breath, makes our diaphragm tight, and because our belly's tight and our diaphragm is held, so that our lungs can't get as much breath because the diaphragm doesn't drop down. So then it forces our breathing up into our upper chest and our shoulders and our neck, which also affects our headaches and migraines. Because if I were to ask people, and if I were to say, okay, take a deep breath, a lot of people will do this. And so I'm exaggerating, but you can see this tightness that happens here. Well, that can be one of the factors that makes it more likely, combined with other things, that you might get a migraine. So if you can drop your breathing down lower into your belly and have your spine move when you breathe. And so I teach practices for this, and there are a lot of practices out there for it, but breathing lower, not necessarily deeper, because breathing lower can help you breathe more deeply. Breathing into your abdomen can then start to ease out. It's almost like doing a massage from the inside, where you can start to ease out this a tightness that occurs with every breath if you breathe high in your body, because you're tightening your muscles and the fascia, all the tissue that surrounds each muscle at every level. So that, and it also calms your whole system down, and it makes you calmer. And that's some of what is done when people practice breathing, practice biofeedback, practice meditation. It just calms the whole system down, which also can help with easing out part of the factors that go into creating headache and migraine. And so there's cathartic type breathing, where you can bring up your history and emotional content. And I've had parts of my body shift from that, like 15-year back injury, through an emotional release and a realization of these similarities in my life that were kind of traumatic, and releasing them, my back released, and it released over time as well. And I got the sense that the body and the cells are holographic, and that we not only just have the physical body, but that our emotions and our mental, our emotional, our spiritual state is all connected inside our body.
Well, I've heard people refer to the body as spiritual tissue, that every cell has a kind of memory, it has a kind of life and an energy. We sometimes think of our body as mechanistic, but it's much more than just a machine.
Exactly. And so that's why, it's a little bit hard to get research on it, because we're so varied, and you might have a headache, but it might start somewhere else in your body. And as you were saying before, you might not have had migraines, you might have other pain, but for people that do have a migraine person in their life, whether it's friend or family, a colleague, it really helps to be empathetic. And migraine people are really sensitive to people who say, oh, well, that's just a headache, and belittle it, because they feel that they feel really disabled by it. And it's not just that they have it that these 40 million people who have them annually, 37 to 40 million people have them for a year. It's like they have them sometimes for years and for decades. And so they get upset when somebody says, oh, well, can't you just go out? It's just a headache, or just take a pill. And when the person is having all these other symptoms. So one thing that if you don't get migraines that you could think about is your worst hangover, assuming that hopefully you're of drinking age, your worst hangover that you've ever had. Your head felt like it was pulsing and pounding and about to explode, and you might have been vomiting, you might have been just like sick as a dog, disoriented, all those things. That's what a migraine can feel like for some people, and for people who have them chronically. And they can go on for a few hours to a few days, and for some people over time, because they're complicated by other factors. And so, or if you didn't have your worst hangover, sometimes people can get those symptoms with the flu as well, or a virus.
So in effect, it's useful to know that in any given day, here in the United States, there may be hundreds of thousands, if not millions of individuals suffering from terrible migraine pain.
They're bedridden 112 million days a year.
112 million days in which migraine sufferers are bedridden every year.
Yeah, and that's just in the U.S.
That's very significant.
That costs companies $13 billion annually, of which about $8 billion is due to lost work days. So, and also kids and teens also suffer. When they're a little younger, kids and teens from about ages 5 to 15, it affects about 10% of them. And then when they get a little older, especially probably more stress, how they use their bodies, and also their hormones are kicking in for women, as I was saying, that's a factor. About 28% of older teens, ages 15 through 19, can get migraine, or a combination of migraine and tension type headache. So it's one of the most prevalent chronic conditions, and it also affects 1 in 4 households in the U.S. So there's one headache sufferer in each of those households. A lot.
So it's a problem that's all around us. Even if you're like me and don't suffer from headaches, you can rest assured that people around you are having this issue.
Usually when I talk to someone, it's like, oh, my sister, oh, my friend, oh, my coworker, oh, my kid, somebody knows someone, just like you said, who gets them. And a lot of times people feel helpless because of that. People in their lives feel helpless. So it does help when doing a program that I'm talking about for the whole family to be supportive and say, do things with their diet or with their exercise or with their stress, that it makes some changes that support not only that person, but the whole family can end up feeling better and being more healthy because they're doing things that can make shifts for them.
Well, I certainly recommend your book, The Headache Healer's Handbook, because you go into enormous detail about diet, posture, various exercises, both mental and physical and breathing exercises that a person can do, as well as various approaches for laying on of hands, which are all very helpful. So, Jan Mundo, thank you so much for being with me.
Thank you for having me, Jeffrey. I really enjoyed it. I appreciate it very much.